Hi, so today we're talking about using dental monitoring for fixed braces or braces cases. Our aims and objectives today is to tell you a little bit about my practice and my training. We're going to talk about how braces monitoring actually works, what's the advantage of using dental monitoring for your braces cases, and what the efficiencies that are possible in a practice as a result of using dental monitoring for braces cases. So I trained at the Royal London Hospital in London in 1997 as a dentist, and then went on to do my orthodontic training in 2003. And since 2006, I've been working in the City of London in an almost 95% adult private practice. The majority of our work is with aligners, and 95% of our patients are adults, which is slightly unusual for an orthodontic practice. Although mostly what we do is aligners, we still carry out a number of braces cases, and therefore implementing dental monitoring is very relevant for us in those cases as well. We're one of the largest practices in the whole of Europe for use of dental monitoring, and we have nearly 650 patients in treatment currently. So, how does braces monitoring actually work? Well, the patient, before having their braces fitted, has a 3D scan. We use the iTero scan, but any 3D scan is carried out. Then what happens is that once the braces are fitted, the patient will carry out weekly dental monitoring scans using their own smartphone. What dental monitoring does is it overlays that weekly scan onto the original pre-treatment 3D scan and actually compares the two and actually calculates how much movement has taken place in those teeth on a weekly basis as compared to the original scan. What this also allows us to do is, if we know that the teeth are no longer moving, we're able to understand whether the wires that we've placed for that patient are still active or have become passive. And that's a fantastic benefit, something that we've never really had before in use of braces cases. Historically, we would change the wire at a fixed interval, perhaps 6 weeks, 8 weeks, or 12 weeks, depending on the system you use. These days, we're changing the wire according to when the wire is passive, rather than a predefined interval. So here's one of my braces cases, a pretty severe class 3 case with an anterior crossbite and wear of those front teeth. And you can see on this picture here, if you compare the left to the right, on the left-hand side, you can actually see how the wire is not active. There's a clear bend in the wire. So we know that this wire has still got some work to do, and it's not time to change the wire. Whereas if you compare to the right-hand side, which is almost a year later, you can actually see the wire is looking a lot more passive, and a much stronger indication that the wire needs to actually be changed. But in addition to that, what dental monitoring also gives you are these clever graphs where what you can actually see is that in those plateau periods, so if we look at between December and February, the amount of movement is very limited. So the wire is plateauing out, which gives us an indication that it may be that the wire is passive and it's time to change. Whereas if you look at between October and November, the wire is still very active, and then there's no reason to go ahead and change that wire at that point. Here's another case, lots of crowding, a crossbite, both anteriorly and posteriorly, and a case that will require quite a lot of treatment. But by having the monitoring in place, we can literally see the teeth lining up, and we know without the patient ever having to come into the clinic what stage they're at and when they need their wires changed. And if you compare between August 19 on the left-hand side of the screen and February 2020, we can see significant progress in the alignment of those teeth. So in this slide, we can see that the wire has very effectively moved the upper right second incisor into alignment. On this screen, you can see on the left-hand side the upper right second incisor and how the wire is very active. And then on the right-hand side of the screen, we can see the wire has become so much more passive and the tooth has moved very nicely into place. Again, if we look at the graphs for this patient, we're able to see the change in movement between each scan, and a very steep and a very active graph suggests that there's lots of movement occurring. And in this period between, say, for example, August or September and maybe December or even January, because there's active movement taking place, there would be no reason to call this patient in for an adjustment. So we would happily leave that patient for at least 3 or 4 months for that graph to become more passive, and aim to see the patient perhaps in February, as it's shown on that screen. Another case here where just looking at the photos here, not even the added information from the graphs, we can actually see how the wire is not passive. We've got quite an active wire there on the left-hand side, and you can quite clearly see on the right-hand side that the wire has done its job and is becoming much more passive in terms of aligning those teeth. And it's the same patient here. You can see the lower canine in particular really aligning very nicely. And by being able to see this, we can gauge the right time to see the patient. The other advantage is that dental monitoring will actually flag up or highlight on the dashboard when the wire has become passive. So you don't necessarily have to watch this on a regular basis because it will be flagged up for you anyway. Here's another case with a deep bite and some crowding, and again a very rotated upper left second incisor. And what we can see between the left and the right hand side of the screen is how the upper arch is leveling out, particularly the upper incisors relative to the other teeth, and how much rotation is occurring of the upper left second incisor. And while that's going on, again, there is no need for us to intervene or call the patient in. It's very much a case of let the wire work, let it do its thing, and actually, as a result, a significant reduction in the appointments that we need for any given patient. Again, we can see the graph for this particular patient, a gradual increase in the curve, showing us that the teeth are actively moving, so no need to call the patient in. But perhaps December time, in that particular example, we would want to call the patient in to do a wire change. So why should you use dental monitoring in braces cases? Well, I think there's no doubt that there's a reduction in chairside time because we're seeing patients only when the wire is passive and at the right interval. Means that there's a series of appointments that we would have otherwise carried out that we don't need to. Early data from my practice suggests that there's a reduction of anything up to 50% in appointment times. Dental monitoring for braces cases is fantastic when it comes to management of emergencies, because we can actually see, for example, a broken bracket or a wire that's digging in before the patient even actually knows about it themselves. And so we're often able to contact the patient to say, we know your bracket has come off, and either we need to see you for an intervention, or we know it's come off and we don't need to do anything at this stage. And also allows for that to be delegated, because a staff member can look at those things and book that appointment in without me having to actually get involved in any way. I think there's definite signs that as a result of dental monitoring, we're seeing patients at more biological intervals, or certainly at more intervals where the wire is ready to be changed, rather than just doing it as we were taught at university every 6 weeks or 8 weeks or 12 weeks. We're now changing those wires or adjusting those braces at the point at which things are passive and there's no movement occurring. Having all of this information on a dashboard, on a screen, means that there's the fantastic opportunity to predict the next appointment. So in my clinic, if I've seen a patient who's got, say, X wire in there, and that wire is now passive, then I know that the next wire I want to put in is Y, for example, and actually I can prescribe that wire to be placed in, or I know that that's going to happen before the patient has even walked into the clinic. It does then mean a lot less doctor time. So in the UK, we can use orthodontic therapists for our treatment, and we can prescribe these treatments to the orthodontic therapist to carry out, reducing the amount of doctor time in any given case. There's also the opportunity to delegate more routine tasks to your admin staff. So for example, like I said, if a bracket has come off, it doesn't necessarily need my intervention. My staff will see that a bracket has come off, and we have predefined appointment slots for that, and that patient will then get booked in for that. So let's look at some data on appointments with braces cases in my practice, both before and after dental monitoring. This is based on the last 63 patients that we have completed treatment on or debonded. Unfortunately, the sample size for dental monitoring, the majority of these patients are non-dental monitoring. Dental monitoring with braces has only been going in my practice for about 18 months or so. So we don't have a huge number of completed cases, but there's very clear trends emerging. And if we look at how many appointments we were needing before dental monitoring, we're averaging 15.7 appointments per case. After dental monitoring, we're averaging 7.1 appointments. So there's a clear reduction in chairside time, anything up to 50%. And if that continues as it is, it will have a very significant effect on the amount of time needed to treat a braces case. I'm estimating that in the last cohort of dental monitoring cases, we're saving anything up to 160 minutes per patient. So I wanted to show you some cases that we've completed, relatively straightforward cases, but these are completed cases. Here's a case that is Class 2 Division 1. There's an increased overjet, and our main aim was some alignment of the teeth and reduction of the overjet. And here the patient is at the end of treatment, and this case was treated out in only 7 chairside appointments using standard fixed appliances. These were non-self-ligating fixed appliances. Here's another case. This is a relapse case with some crowding in both arches, a tendency towards a Class 3 and a crossbite tendency as well. And again, here they are treated at the end of treatment, reasonable result in 8 appointments from beginning to end. So again, a significant saving in chairside time to pre-DM. I mentioned about emergencies, and this is a great thing that you can actually spot. If we look at this picture on the left-hand side, you can see there's a bracket off and a wire is digging in on the lower right side. And you've then got the opportunity to contact the patient and make a decision on whether this needs to be dealt with immediately or whether this can be left alone. And we've informed the patient that as long as this is not giving you any trouble, you can leave it and we can do this at the next visit. So it gives us that control without waiting for the patient to contact us and saying X, Y, Z is broken, or a patient just turns up to the clinic and we don't know what's gone wrong. We have to figure it out on the day. We're actually prepared in advance as a result of dental monitoring. I hope that was of some use to you, and I wish you well with your dental monitoring and braces journey.